Hello, I'm Dr. Mary Currier. Infant mortality is one of our biggest problems in this state. We have about one baby per day dying in this state year in and year out. We have the worst infant mortality rate in the country. In addition, African Americans have a rate that is twice the rate of other folks in this state. We're here to try and help expectant moms know how to make sure that their babies have a healthy start. One of the things to do is to make sure that you're healthy before you get pregnant. In addition, take folic acid before and during pregnancy. It's very important to know how to put your baby in a crib. They need to be on their back and in a smoke-free environment. Breastfeeding is also very important. It helps babies not be obese when they're older, and it also decreases the risk of infant mortality. And please don't overfeed your baby. We want them to be a healthy weight throughout their life.
We have formed Mississippi Sisters United to ensure that you have the proper information needed to increase awareness about infant mortality and to make sure that all Mississippi babies have a second birthday. We want you to use this information with your loved ones to ensure that this happens.
I encourage you to watch this video and share it with your friends and colleagues. We need to do everything we can together to ensure our babies have a healthy start.
Did you know that birth defects are among the most common causes of infant death and childhood disability in Mississippi? But there's a simple step that all young women can take to prevent the chances of their baby having some of these birth defects. By taking folic acid every day, a woman can decrease the chances of her baby having a brain or spinal cord defect by up to 70 to 80%. So what is folic acid and where can you get it? Folic acid, or vitamin B9 or folate, is a vitamin that can be found in many healthy foods, like citrus fruits like oranges, grapefruits and orange juice, dark leafy green vegetables like spinach, collard greens, kale, and broccoli, beans and peas, and many whole grain breads and fortified cereals. Although I highly recommend that all young women have diets rich in these healthy foods, one of the easiest ways to get enough folate in your diet is by taking a folic acid supplement or multiple vitamin that contains folic acid, or just taking a prenatal vitamin. It's really important that women take at least 400 micrograms of folic acid every day. If you're already taking a multiple vitamin, be sure to check the label to make sure there's at least 400 micrograms of folic acid.
SIDS, or sudden infant death syndrome, is the untimely and sudden death of an infant under the age of 12 months due to an unknown cause. In the United States, SIDS is the #1 reason for infant mortality in infants between the ages of 1 and 12 months of age. African American infants are particularly at high risk of demise due to sudden infant death syndrome. The most ideal sleep scenario for an infant is to be in the same room with the parent in a separate bed, and that can be a crib, it can be a portable playpen, or it can be a bassinet. The surface should be firm and there should be a fitted sheet present. There should be no stuffed animals, blankets, sheepskin, pillows, crib bumpers, or any other objects that might obstruct the baby's head. Also, it is important never to put your baby on a couch or a waterbed or a chair. Sudden infant death syndrome cannot be prevented, but there are ways to decrease the risk. Please remember to place your infant on his back at all times during sleep time. Always put your infant in the same room in a separate bed with a firm surface and fitted sheets. Remove everything from the crib. A bare crib is best. Turn down the temperature, and remember to never smoke around your infant.
Breast milk is the most complete form of nutrition for infants. It has the right amount of water, the right amount of protein, the right amount of fat, the right amount of sugar that your baby needs to grow and become healthy. A benefit of breastfeeding is the bond that it creates between a mother and her baby. It increases the self-confidence and the self-assurance that a mother is doing everything that is possible to ensure that her baby is getting the best nutrition that is available. Infant mortality is one of the greatest health problems here in Mississippi. And one of the major reasons for that is because of our high obesity and overweight rates. One of the things to remember about maintaining a healthy weight is that it is important both before, during, and after pregnancy. The period before pregnancy is called the preconception period. That's the period before you ever conceive your babies. It's important that you maintain a healthy weight during this time because overweight and obesity contributes to many of the chronic illnesses that result in poor pregnancy outcomes, such as preterm births, low birth weights, very low birth weights, and stillbirths. Pregnancy is not the time to lose weight, but it's important to have a healthy weight before, during, and after pregnancy. Many times women gain too much weight during pregnancy and find it harder to lose the weight after birth. In conclusion, it is important that you maintain a healthy weight before, during, and after your pregnancy.